Okay. Again, thank you all for joining for our final exam study session, informational session for FLP 214. I'm really excited to be together today and excited to wrap up this semester. I know that's always a mix of a stressful time as well as an exciting time as a professor and as a student. Um, so overall, some basic information. All of our grading should be completed now besides this past week's module. I will have that done this evening. Um, Overall, our final will be 48 questions. It's a mix of true and false questions, right in the definition of blank. So fill in the blank questions, multiple choice questions, and yeah, that's it. And then it's based on modules 1 through 15 overall. You can use a 3x5 note card with writing on both sides to serve as your memory aid, just like we've been able to do for most of our, or all of our quizzes so far. So making sure that you have your note card ready beforehand is one of my study tips that I have today. The second one is review your quizzes throughout the semester. One thing that I did notice is a lot of the topics that we talk about in our quizzes and have quiz questions on then shows up again on your final, right? So taking the time to go through each one refreshes your brain on the way that the questions are worded, so then you don't have any surprises when you go into the final. Um, the next is reviewing the phonological disorder Quizlets. There are some phonological disorder questions on our final that I think just some reviewing with your Quizlet that's posted in announcements would be helpful. And then lastly, review the midterm YouTube. I will be going through the IPA today as well, but that refresher on the IPA I think would be really helpful, and utilizing that IPA cheat sheet and going through all of your sounds and just remembering what they're like so that your brain is primed, right? Um, Remember when you're taking your test, preparation is 100% in your control. So take your time to study, right? Make sure that you are prepared. Remember that although you are online learning and you're taking this at home, still act like you're going to a place to take it. So get there 5 to 10 minutes before you actually start the exam, right? Sit down, review your notes, maybe give yourself some positive praise, feedback, because normally in a traditional learning environment, right, you'd be sitting next to someone and your friend would tell you, like, hey, we got this. I know this was harder for you. Let's go over it really quick, right? So be that person for yourself. So that's your refresh portion of this, right? And then while you're taking your exam, don't let your feelings get bigger than your thoughts overall. Make sure you take the time to pause, read the question, and really understand what it's asking. And then also look at those answers and take the time. Some of the answers really, they're not the answer, and you can tell and you can eliminate some answers, right? So just those normal test taking strategies and tips I wanted to make sure we go over to have the most success possible, right? Remember, test taking is scary and intimidating at times, but with preparation, refreshing, and pausing, it can make it a lot easier. So with that, let's dive into it. First thing we're going to talk about is some anatomy overall. Um, so our anatomy, we have our systems, our supraglottal, which remember supra is above, right? So it has the glottis, the pharynx, the oral cavity, and the nasal cavity, right? Up. Subglottal is below. Think about your submarine below. So your lungs, your trachea, and your diaphragm. Your larynx is your vocal folds, also known as your glottis, right? So that's our start, our point. Supra would be above, sub is below. Okay. Um, then when we're talking about our speech sounds and we're looking at our IPA, right? Remembering that our bilabial sounds are where our lips touch, our labiodental, so our lip teeth sound, right? So those would be like our and our lingual dental. Tongue is lingual, dental is teeth. So that would be your tongue between your teeth, right? Lingual, again, tongue. Alveolar is our alveolar ridge right behind our teeth. Palatal is your palate, right in the central there. Velar, velum, all the way in the back, and glottal, right, is our glottis that we just talked about. Okay, remembering that your tongue is rooted to the bottom of your mouth with your frenulum there, right? So underneath. Um, and then we also have to make sure that we understand the central nervous system, which includes your brain and spinal cord, and the peripheral nervous system, which includes the nerves that run from your brain or spinal cord to the muscles and lower motor neurons. Okay, so that's all of our anatomy overall, very quickly, right? So our lungs, our diaphragm, and our trachea are all part of that subglottal below. Then we have our vocal folds, and remember that those impact our voicing. Whether or not they vibrate is whether or not a sound's voicing is on or not. Then our supraglottal, everything up here, above our vocal folds, which is our tongue, our teeth, our lips, our velum, our nasal cavity, our pharynx, and like that oral cavity. One suggestion I do have is going through that IPA cheat sheet and saying all of your words out loud. So I'll do a little example with our vowels because I feel like the vowels is the trickier part for most students. Um, so let me share this really quickly. And I love this IPA cheat sheet. I use this often myself, right? Um, so our first phonetic symbol is I, as in kid, bit, and minute. Our next one is A, as in bait. Our horseshoe is as in took. Our It looks like the letter U, but this sound here, this phonetic symbol, is oo, like in blue. We have a, as in fat. Ah, as in hot. Ah, as in caught. As in strut. E, as in fleece. As in of. F, as in bet. O, as in okay or boat. As in bird. And again, as in mother. We also have our diphthongs, which means two vowels that come together. So we have I, as in ice. Oi, as in boy. Ow, as in now. Oo, as in Q. So going through our vowels, make sure you go through your consonants as well and really have an understanding of all of those sounds. Know the place of articulation, the manner, and the voicing as well, or be able to think through it, right? So one thing I know that we've talked a lot about throughout the semester is if you are confused, take a second to think about it, right? So if we have, I have some question options for us in a little bit, and we'll go into some questions. Does anyone have a question as of right now about any of the anatomy or the IPA? Great. Oh, I think I see one. Not a lot of IPA questions, but there are some phonological process questions. Sorry. So I see the question in the chat is there a lot of IPA questions? So there are some where you have to be able to identify. So if this word, which one of these selections is the right IPA? If this is the phonetic spelling of it, which one of these words in English? There's not too many of those, but there's more questions about applying those concepts for like phonological processes as well as articulation disorders. Does that make sense? I think there's like 3 or 4 that are straight IPA questions. You can use that blank piece of paper to write it out if you need to. Yes. I personally find that to be helpful. Make sure that you're showing me the front and back of that piece of paper in your, sorry, in your study area check, environment check. But you really won't, you shouldn't need to write down most of them. Most of them are very straightforward and should be a little bit easier. I found when I was looking at it. Any other questions? I just want to make sure that we know to review the IPA. It will be a part of all of the information on here, and applying it is a big part of our second semester. Perfect. If you do ask a question and I don't respond, please raise, like do the hand raise or make a noise so I don't miss your question in the moment, okay? So when we're talking about, let's dive into articulation. So with articulation, this is a difficulty producing sounds. This is not rule-based. It is not rule-based, right? With articulation, consonants are more impacted than vowels. You might have a reason to have an articulation delay. You might not have a reason to have an articulation delay. A lot of times, commonly, there's not a pure reason for it. You may result in unintelligible speech, and there's 4 common articulation errors. The first one is omissions. That's leaving out or does not produce a sound. So it's omitted, right? Deleted. Or not deleted, it is omitted, and it's not there. Substitution is where we substitute one sound for another. Distortions. So it sounds like what it should, but it's not exactly the right sound, right? Distorted, it's changed. So this is where we think a lot about our lisp, like our frontal lisp or an interdental lisp, which is a problem with placement. Our tongue comes out of our mouth. So, right? Or a lateralized lisp, which is an airflow problem. Your air is pushed to the side. It sounds wet and slushy. So is more of the sound we get there. And then our last articulation error is additions. And this can be a sound or a syllable added to a word. This can be developmental, but it should be reduced when they get older. So we have articulation, and then we have phonology, right? And phonological processes are rule-based overall. So for our test, a child is producing this. For this, what phonological process are they exhibiting? And you have to identify it. These are predictable error patterns that should be extinguished by the age of 4, okay? So let's go through those phonological processes. We have cluster simplification, which is where we take a consonant sequence and you simplify it by deleting one or more of the consonants in there. So the word that I always think about is street and saying steet or street, but you're deleting one or more of the consonants in there. Spaghetti is a very typical one that we hear. Deaffrication is our next phonological process, and this is where an affricate is substituted for a fricative. So the fricative is produced in the spot of an affricative. So sh is being produced for ch, or j is being produced for j, right? Deaffrication. We have deletion of final consonants. Final consonants is the last sound in the word, final, end, right? So taking off that last sound. Initial voicing is our next one. This is where a child or client will produce a voiced consonant at the beginning of the word instead of a devoiced consonant. So this would be using bop for pop as an example. So I turned on my voice. So we can see how being able to know that B is a voiced consonant, and that's where our IPA comes in, and knowing that you're substituting that for pop. So you know both are in the same place, the same manner, however, our voicing is what's different. So really applying the IPA is the big portion. Liquid simplification is when we replace L and R with like a W or a Y sound. This one's very common as well. I'm sure most of us have heard this. Fronting is where we bring a palatal or velar consonant, so one's more towards the back, to the front of our mouth. So saying cat for cat, right? So we're taking that k and bringing it up towards the front. Stopping. This is when we use a stop for a fricative or an affricative. So saying something like dis for this or to for shoe would be stopping, right? We're stopping that sound. You're not able to hold it. And then syllable reduction is when we produce a fewer number of syllables than what is in the target word. My son is 2. He does this right now. He says nana for banana. We're really working on that buff, but it does not have it. So syllable reduction, right? Another common one. Those are our phonological processes. So in our exam, you're going to be asked, this is the target that the child is producing. This is the word they should be producing. What phonological process are they exhibiting? Question. And I have examples of questions for towards the end as well. Actually, I think this is a good time to go through some of them. So in our chat, I am going to place, we just tested it out and it seems like it'll work, a website. I want everyone to go to it. And this is where our final exam study quiz is. You should be able to answer the questions. You should be able to go onto it on your phone. Let me see if I can, let me get the QR code. There we go. Let me share my screen. This should work. So if you are looking at your computer, scan that QR code. Double check it works. Well, let me know if it does not work. But it looks like it should on my end. And if anyone wants to give me like a thumbs up when you could do a thumbs up when you get on it and you're ready for us to start. Okay, that looks like everyone. Is anyone having an extreme problem? Okay, okay, perfect. All right, so first questions that we have. Oh, nice. Okay, you guys are starting to answer them, but our first one, let me do present here. What is the anatomy on the roof of your mouth, just behind your upper teeth and in front of the hard palate? That's up. My favorite statement that I will remember from forever from my linguistics professor. ski the alveolar ridge. For whatever reason, it just makes me remember it. That is your alveolar ridge there. Great job for anatomy. Awesome. All right, next one. When making your top teeth touch your blank, write in your answers. Does it let you write in your answers? Okay, it does. Lower lip, bottom lip. Correct. Great job. So this is an example of the type of question that you would see on the exam. Again, not too many like this for your IPA review portion, but make sure that you do understand your IPA. Awesome. I'm going to go on to the next one. Place, manner, and voicing for G. Oh, oh, there we go. I think I can hide. All right, there we go. I'm going to hide responses while everyone's answering so that everyone has a fair chance. And then I'll show them again when we get more responses from now on. So there we go. G is a velar. It's a voiced, right? G, feel it. G. You can feel that their voice is on. You can feel it in the back. It's a velar sound and it stops. You can't hold on to that G sound. If you're holding G, you're holding the sound, not the G sound. Okay. Place, manner, voicing of perfect. Um, so looks like we have everyone in agreement, right? Let me pull. So it's an lingual alveolar, fricative, remembering that it's lingual alveolar, right? So that our tongue is impacted as well. And it is voiceless. So alveolar is acceptable as well. Fricative means that we can hold on to that sound, right? The whole time. All right. Place, manner, voicing of mm. I think this is our last one. I went a little overboard with the IPA one. Perfect. This is a voiced alveolar nasal. Agree. Um, Making sure that you're using place, manner, and voicing when you're describing them will be important for full points as well. All right. How many sounds in the word check? All right. Ch, eh, three sounds in check. Make sure that you're not getting confused by those digraphs. So CH is one sound, ch, right? Ch, eh. All right. Which ones are the labiodental sounds? So you get to choose A, B, or C. Labiodental. Okay. And great job. Labial is lip, dental is teeth. So teeth on lip. How many sounds in the word sleep? Sleep. Four sounds. Great job. O, E, sleep. Remembering how to break up and know those sounds, number of sounds in words is important. The the area above the glottis that includes the pharynx, oral, and nasal cavities is supraglottal above. Great job. The CNS, the central nervous system, includes the brain and spinal cord. True or false? False. True. Great job. Making sure to review your anatomy. In the word cat, where is the k sound located? What position? Initial, medial. I have end. It should say final. I apologize for that. Initial. Great job. When we get into and when we talk a lot about articulation therapy, understanding where those sounds occur in words is important, right? We went through our articulation errors. So when an individual uses w for it's considered what type of articulation error? Substitution is correct here. So remembering that a phonological process is a rule, so it would be all liquids. Um, but when we're just substituting one sound for another sound and it is not rule based, that's a substitution. When an individual adds at the end of a word, it's considered what type of articulation error? Addition. This is one of the questions I wanted to make sure like we talk about, right? We could look at this question and be like, I have no idea immediately, right? But we can find the answer to the question by reading it and dissecting what the question is asking, right? They're adding something to this word. What is it? Addition. Makes sense in that way. When an individual exhibits a lateralized lisp, lateralized is spelled wrong, is it considered? Oh, wow. What type of articulation error is it considered? When you type on this computer program, it's very, very small, so I wasn't able to proofread. This is a distortion. So an omission would be when that sound is deleted. So a lisp, we use our s and z sound. So omission would be if we had the word cat and then we knock that S off and just say cat. Distortion is when you change the sound and it adjusts it, and you're making it, but you're not making it correctly. And then substitution is switching for another sound. That would also be like another sound. So W for R, we're switching those. When an when an individual drops the g in dog, what type of articulation error is it considered? Omission, delete, omit. Great job. Okay, and then let's dive into some of the phonology, okay? Name that phonological process, so you're gonna have to type. Um, okay. Uh, the child produces doy for toy. Okay, so this was a little bit of a harder one. So remembering phonological processes, substitution is an articulation process, right? So this would be initial voicing. In order to understand this, we have to see that the t is moved to d. So when I make t, I know it's an alveolar sound because my tongue goes up and goes down, right? I touch that alveolar. When I make d, same thing happens. So I know they're the same place. I know both of them stop. I can't hold on to. I can't hold on to. So it's not a place a difficulty with manner. And then when I do my voicing, d, d, you can feel your voice. Oh, so that would be initial voicing. Any questions on that one?
Can you give another example of initial voicing?
Mm-hmm. I can. Using gat for cat. Um, using bop for pop. Anytime you have a voiceless consonant first, so C, using Z for C, turning on your voice on that initial consonant. Does that make sense?
Yes, thank you.
Sarah, I see your question. When a child has the vocalic R distortion, don't they typically use W for R? So no, this a distortion would be slightly changing the sound where what is a sound within our vocabulary. It's a sound we use. And are sounds that we do not use within our vocabulary. And that's where the sound isn't distorted, it's substituted for a different sound. Does that make sense, Sarah? Okay, perfect. Great questions, guys. I love answering the questions. So as you have them, like put them in the chat or raise your hand or just unmute and talk it up. Name that phonological process. The student child produces cool for school. Okay, let's look. Cluster reduction or simplification would be you're correct. Um, Stopping is not correct in here because we're just taking off our sound and it's going away. Um, and then substitution would be changing one sound for another. And also that's an articulation um, portion where this part we're looking at phonological processes. So that's your cluster simplification. I can't see who answered what, but I can see your answers. So if you have any questions about it, let me know. Oh, and then syllable reduction would be like taking off the f in banana. This is a sound, not a syllable, that went away in this example. Your student or person produces two for shoe. Oh, I think I used this example earlier. Two for shoe. So stopping would be the correct answer. And deaffrication, the reason why I used sh was just to have you guys think about sh is not always leading to deaffrication. You want to think about sh is a fricative and it goes long, t is a stop sound, right? So we are stopping that sound overall. So that would be a stopping is the phonological process. Um, Mashes or matches? Okay, deaffrication. Great job. Deaffrication, stopping sh does not stop. So it's not stopping that sound. Um, and then syllable reduction would be taking off a syllable like that, ba being taken off of banana, or butterfly, butterfly. That would be a syllable reduction as well. I'm going to go, okay. I'm going to stop sharing. I know everyone still has access to that quiz. I'm just going to ask that you don't go forward until we go over some of this apraxia and dysarthria treatment and the rest of the information because it's kind of all smashed together from here. Um, okay, so we went over that phonological process, the articulation, the IPA, right? This is the basis of the whole course overall. So make sure that you do have an understanding. There are a good amount of questions that are on that phonological process on demonstrating knowledge of the IPA as well as articulation. So let's get into dysarthria. Dysarthria, we want to think about strength, speed, timing, direction, and range of motor speech movements is impacted, right? This can be caused by damage to the central nervous system or the peripheral nervous systems, that's CNS and I just lost my page, CNS and PNS. The aspects of the impaired speech and dysarthria depend on the location of the damage. And then remembering when treating our dysarthric speech, you may include oral motor strengthening exercises and learning compensatory strategies and techniques to improve intelligibility. So overall, we're talking about a weakness. We have 6 different types of dysarthria and understanding each one. Flaccid, it's going to be weak muscle tone. Spastic, think about muscle spasms. Ataxic is our drunk sounding speech. Hypokinetic means reduced, right? Reduced movement. Hyperkinetic means extra. Think about involuntary movements for this one. And then mixed. Mixed is our most common, where you have a little bit of more than one. It's not just clearly one, but that is your most common is the mixed overall. So when we talk about dysarthria, we're talking about a weakness, right? But then when we get into apraxia, apraxia is a difficulty with motor planning. They're not weak. It's a difficulty with the programming associated with the neural commands. Now, apraxia can be acquired or developmental, right? So we talk about childhood apraxia speech and acquired apraxia speech. Overall, though, apraxia has a tendency, people with apraxia have a tendency to grope for words or sounds. Often rote or automatic speech is better. You do see some vowel errors, which we talk about in articulation. You don't really see very often, right? So this is one of your hallmark differential diagnoses, those vowel errors. And then the inconsistent productions of the same word. So it won't be the same every time. Many substitutions are usually the most common error types. When we're talking about childhood apraxia of speech, we don't know the cause. Don't know the cause. Acquired apraxia of speech, however, the causes could be a stroke, a TBI, a tumor, surgical trauma. It can be a neurodegenerative disease such as Parkinson's. We know that there are two different types of apraxia. When we're talking about childhood apraxia of speech, they are born with it. There's no known cause. Students and children with childhood apraxia of speech understand language better than they're able to use it. They have some difficulty organizing spoken information clearly, and they demonstrate poor language skills, including vocabulary and grammar. Problems with reading, writing, spelling, or math also comes hand in hand with childhood apraxia of speech. They also can have other speech disorders, difficulty with coordination and motor skills, because we talked about this is with the motor planning overall. They're not weak. Dysarthria, think weakness, apraxia, motor planning. The other area that we really hit on this semester is organic speech disorders. Organic speech disorders. So we have a couple of different ones that we talk about. We have cleft palate, right? That's when the two sides of the palate, think about your palate, is like the roof of your mouth area. Two sides don't fuse together. That causes an opening in the roof of the mouth, which goes into the nasal cavity. Think about when we are speaking, that air comes up through our lungs, through our vocal cords, impacted by our vocal cords, and then our diaphragm has to close in order for that sound to come out, right? We have a complete closure, and the air comes here through our mouth, and our mouth then impacts that airflow. But if you have a cleft palate and you're not able to have all of that sound closed off, the sound goes through your nose. This can happen environmentally, in utero. It can be caused by genetics, environmental, or some syndromes. A student or child or person with a cleft palate may produce more nasals and glides and glottal sounds. They're going to have difficulty getting closure to produce those stops. You can't produce the pressure to, right? And that air goes into the nasal cavity. And then also this can lead to limited vocabulary, hypernasality. And then after surgical repairs, there's often an increase in consonant acquisition. Next, we talked about ankyloglossia. This is the glossus tongue. Think about an anchored tongue, right? We talked about that frenulum. It's a common genetic anomaly that is usually detected right after birth. It occurs when the tongue is partially or at times totally fused to the floor of the mouth due to an abnormality of the lingual frenulum. Your lingual frenulum, if you look in the mirror and you pick up your tongue and look underneath, your tongue is attached to the bottom of your mouth by your frenulum. And that would go, if there is a tongue tie, is the way we usually call this, that frenulum can go all the way to the tip of your tongue. Doesn't always impair speech. You can get it clipped by an ENT. Sometimes, or definitely, if you do get it clipped, you have to do exercises to not allow it grow back. We also talked about a tongue thrust is when your tongue is going forward against your teeth or in between the teeth while swallowing. It starts as an infantile pattern of swallowing, but if it's maintained, it's difficult to correct. And then hearing impairments is the other organic speech sound disorder that we talked about. Not being able to hear your sounds at different levels impacts your ability to produce them. Okay. And then two other topics that I wanted to make sure to touch on are your learning theories and our sensory approaches overall. So our learning theories, remembering that behavioral is Skinner, cognitive is Piaget, humanistic slash experimental goes towards Maslow, and social is Bandura. Knowing your theories, knowing who created them is important for you as well. And then when we're talking about therapy overall, a multisensory support system is important, right? We want to honor the person visually, uh, visually, auditorily, tactile, and kinesthetically. So movement as well. So touch, movement, and we want to use all of the senses within our therapy in order to make it as effective as possible. I went through a lot just there. Does anyone have any questions? Otherwise, I have some quiz questions for us too. Feel like everybody kind of enjoys the quiz questions a little bit more. So let me share my screen. Um, get back onto your phone, your page, wherever you were answering the questions. And apraxia is due to weakness. Oops, didn't hide it. Sorry, guys. This is presenting, right? You can see it. Okay, there we go. I lost the chat for a second. Okay, false. Apraxia is not due to weakness. Weakness, dysarthria, which is a motor planning speech disorder. Motor planning, apraxia, right? Dysarthria, remember, is that weakness. Well, surprise. Weakness associates with dysarthria. Great job. What is the most common dysarthria? Mixed is correct. Mixed is the most common. Um, true, false, or I don't know. A characteristic of apraxia is a tendency to grope for words or sounds. True is correct. That is one of um, our signs and symptoms of apraxia. The cause of childhood apraxia speech is a lack of oxygen during huh, birth. Birth. False is correct. We do not know the true cause of childhood apraxia speech. A multi-sensory treatment approach. Which do you use? auditory, visual, tactile, kinesthetic, or all of the above? Great job. All of the above. Again, the answer is in the question, right? Multi-sensory. Multiple. That was all my questions that I created. I wanted to make sure that we had some good examples of questions that might be on the exam, as well as like, especially with the format of them. Again, like a suggestion is just to go back and look at your quizzes and your midterm so that you're not surprised by the format of questions, right? It's just one of those things you can do to prepare to get your brain ready to take an I did make sure to go over all of the information that would be on the final, touched on everything overall today. I am going to stop recording